Hello and welcome to Wimpole Street Dental Clinic. My name is Christian, and in the following video we would like to show you how we produce crowns and bridges. We really thank you for your time and we hope that you enjoy the video. Thank you.
So let's start with the crowns and bridges explanatory video, and I'll explain to you how we do crowns and bridges best with always some treatment examples. And we start with the golden standard of bridges, which is a metal ceramic bridge. That means the framework is made out of metal and the veneering is done with ceramic. Bridges has still a place in dentistry. You cannot solve every case with implants, and in case, for example, there's an old bridge or serious damage to the adjacent teeth of the gap where the tooth is missing, then the bridge is still an option. So you can see a case here with on the left side an old bridge, normal front teeth with some fillings, and on the right side a bridge with a golden framework, and you can see some cracks, and the patient wanted to have these bridges renewed and just have a perfect and normal smile again. So the first step which we do is that we remove the old bridge, see what's underneath, and you can see here from left to right the old bridge on the left, then the bridge taken off. You just slice the ceramic and the metal framework lying underneath, bend it a little bit, and then you can easily take it off. And on the right side you see a stone plaster model taken from the situation before, and then the dental technician just adds a little bit of wax to adjust for form and shape of the existing bridge, so that we can prepare an ideal temporary already and that the patient can test the situation. And then you can see here on the left side the new bridge in place, and on the right side the bridge before we cemented it. You can see the metal framework lying underneath and being beautifully veneered by the dental technician with ceramic. And these bridges still have a place in dentistry. They are still absolutely acceptable. We nowadays don't do them anymore, as new materials have rendered metal ceramic bridges obsolete, but we wanted to include it here because they're still done in numerous ways and numerous times throughout the world. What we do nowadays is full ceramic bridges. We have new materials since several years which have been scientifically proven to be completely adequate and even better than metal ceramic versions for restoring situations where teeth are missing. So we have a patient here, initial situation, not happy with the front crowns, they're rather old, and she could see the margin had a small decay on the margins as well, so she wanted to have just a beautiful normal smile again. So first step is always take impressions, get these impressions to the lab. They produce a so-called wax up, that means an imitation of how the teeth should look like at the end of our treatment. Then, as in the case before, we remove the bridge, remove the old cement rests, the old fillings, the decay, and restore the teeth to perfect health again. In case there's, for example, a periodontal disease, we do that as well. Then we re-prepare the teeth and take a proper impression. And you can see here the model made from the impression and the new full ceramic bridges. You can see this bridge has been done approximately 10 years ago. We're much better now with regards to color, but in this case the patient wanted to have very white teeth as well, which is understandable. If you spend so much money, you want to have beautiful teeth. You can see the full ceramic bridges, you can see the absence of a metal framework, and then single full ceramic crowns in the front as well. And then you can see the situation here is absolutely perfect. Gums are healthy, no decay, and just wanted the patient just to leave the crowns in the upper jaw left. That means here on the picture on the right side. And that's the situation then with the try-in. And then the final situation cemented after 1 week. And you can see these teeth look quite natural. The gums in between the teeth will still have to recover a little bit because of the placement procedure. We have to push the gums a little bit away that we can the crowns really cement properly into the tooth. Next case is a full ceramic bridge for front teeth. You can see for a dentist a very difficult situation where you have gum lines of different height, different color, and we decided to go all the way. That means adjust the gum lines, do orthodontics to put the teeth in proper position first, do a connective tissue graft from the palate to really level that out. That took approximately 1 year to solve the situation. You can see here the gum lines have been corrected. For the front teeth, it's a little bit more, but we always need a little bit more. Sorry for say that meat, which we can adjust a little bit more gums that we can adjust. Take the colors again, prepare the teeth, and then have the final situation placed. The central incisor on the right side has still a little bit more gums, but that's okay because we've done a so-called connective tissue graft. That means a graft from the palate here, and the gums here will recede within the next 1 to 2 years by approximately 0.5 millimeter, maximum to 1 millimeter. So you can see perfect work with regards to ceramic, good margins, and for on the right side, the left lateral incisor is adjusted well to the gums as well, and this will stay as it is. So you can see here in the detailed photograph that the margins are good, gum looks good, and it looks like natural teeth actually. And again, the gum between the teeth that will adjust, but that will take half a year after placement. And the patient, of course, was very happy with the result. Here I've taken a picture without a flash, so you can see the different layers of the ceramic, especially on the incisal edge, where you can see a little bit translucency, so that we can actually pretend to have natural teeth. Of course, we have cases as well where we don't have just white teeth. And you can see here how far we have come. This is a bridge case from 2019. A patient didn't brush his teeth very well, didn't care for color very much, not very beautiful teeth, but of course we have to manage somehow to have our work fit into the situation perfectly, which is in this case, as you can see, is quite colorful, very difficult. So what we do now, we take different colors with different shade guides, using the shade guides done by or used by the laboratory as well, which is matched by the ceramics which they actually use. Take several colors so the technician has perfect work. And you can see here, as I said, is a rather modern case. We took digital impressions and have a printed model, and then a milled bridge out of a ceramic block. And this is a bridge. This bridge is not veneered anything. This bridge is just painted. I think the technician has done a wonderful work here, and you'll see if we fit this bridge into the mouth, it blends into absolutely perfectly. So you can see the bridge here. This is the temporary. These are the prepared teeth underneath. And this is the bridge, and you can see already now, color-wise, this bridge is going to fit absolutely perfectly. So, wonderful case from the dental technician, and you can see all the effort we put in to color taking really paid off. And then you can see the bridge in place, bite perfect, color perfect, nothing to complain about. Let's go and can cement it. So you can see here the advancements we've made in technology. This is non-veneered bridge, just painted, full ceramic, milled from one block, stability, you can drive a car over that, and it works absolutely perfectly. So I'm really pleased with the advancements in technology, as this makes our life so much easier and makes the result for our patients so much better. And then after cleaning the teeth and after the cleaning bridge again, the bridge is cemented in. You can see the white stuff coming out, that's the cement. We clean that and you can see the bridge is gone. You can't see anything anymore. Very colorful teeth, not very beautiful teeth, but our bridge blends in perfectly to that. You don't see that we have been there. So I'm very pleased with that result, although it's not just a white fence of beautiful American teeth. Here the detailed picture, and you can see perfect color. I was really pleased with the result on the day, and the patient, of course, was very pleased as well. The x-ray at the end shows that the margins are all perfect, no infections from the teeth, and of course we have to get the patient to properly brush this bridge. And these were the conventional bridges. Now in the next sub part of this presentation, I'll show you options in case you do not want to have implants or surgery, or bone grafts for that matter, what we can do with Marian bridges. You've seen this case as ST's case 1 already, down below, and or you can find it as well as a full case in our video library. And this is a case where lateral incisors were congenitally missing. So we took the color, prepared the teeth, took the impression, in this case the conventional way, and had then the bridge prepared. And you can see the front teeth are not really prepared. There's just the back of the teeth a tiny bit prepared, so the teeth only lose approximately 10% of their structure. Always check the thickness of the wing. It should have approximately 0.7 millimeters minimum thickness. In this case you can see with 1 millimeter thickness, which is fantastic. And then the bridge is in place. This is directly after placement. This picture has been taken, so there's a slight color difference. In a couple of hours it will be exactly the same color. And then the bridge from behind, from the palatal side, and you can see absolutely perfect fit, and the small ridge you have on top of the teeth is normally no problem for the patient to accept. And you can see the final picture. Color, like I said, will adjust. The gums on the right side will adjust a bit as well, but it takes a couple of weeks. Last case, I think, for today. You can see that you have to be important that you always choose the right materials. This case, the dentist has done. The patient has done a Marian bridge with another dentist, and he used a metal framework. And you can see the metal framework is shining through the teeth, and the teeth are discolored because of that metal framework. So of course this is not a situation for a 22-year-old girl. So what we did is, firstly, for you, take a picture from behind. This bridge will last you a long time, but it's just not acceptable with regards to how it looks. And so we cut the metal framework, and give some injection, adjusted the gums a little bit, made like a splint which you could wear at night, and then prepared the teeth on the same day. You can see here as well, we've got better with the colors, even from the palatal side, from the inside. So that looks really perfectly now. And after 1 week, we're ready to place a bridge. See, the gums look perfect as well. And of course we place the bridge with a rubber dam. And that's about to look perfect. You have to, the bonding technique is a little bit technique sensitive, so you have to do it really in the proper way. And if you do that, you have a success rate of approximately 80% over 20 years, which is comparable to conventional bridges and or implants. And you can see here the final situation. Our bridges blend into perfectly to natural teeth and the normal situation. So it's a great achievement in this case, and you can see no color problems anymore. You can see the picture from the behind, so that looks absolutely perfect. Very pleased with the result. Patient was as well. Blends in perfectly into the natural environment, and you can't really see that we've been there. Of course, you can do bridges as well for the side teeth, Marian bridges. So that means you don't have to drill too much away from the tooth. This is an experimental technique. There's no data for that, but my personal experience is that I have not seen one single bridge falling out, and we've done approximately 15 to 20 of those bridges for patients who didn't want to have implants. So you can see the initial situation on the upper jaw left. That means here on the picture on the right, a tooth is missing, and the patient did not want to have implants or surgery or anything. So we took the color, prepared the tooth, took the impression, and prepared the bridge. This is a bridge, of course, made from ceramic, full ceramic, no metal in it. And then we bonded it very carefully with a special adhesive cement again. This tooth before, and that's the situation directly on the day of placement. You see, tooth is perfectly replaced. You can't really see that it's a fake tooth, except when you look from on top, then you see the framework and the veneering. So these bridges are in some carefully chosen cases. You can do these bridges as well instead of an implant or a conventional bridge. So thank you very much for watching, and I hope you enjoyed this small video about bridges and Maryland bridges. Thank you very much.